Hi, I'm Meghan Stufflebeem. I'm a PA here at Fountain of View MD. I have been a physician assistant for over 3.5 years. Originally, I started in critical care medicine and saw some of the sickest people and realized that my calling really was to go into preventative medicine to help people avoid places like the ICU. I joined Fountain of View MD because I wanted the opportunity to build relationships with my patients. I have a passion for preventative medicine. I love health and wellness and wanted to be part of a practice that really focused on patients' vitality. I feel very fortunate to be a part of our patients' weight loss journeys. Weight loss is obviously very personal and can impact so many different facets of one person's life, from the physical benefits of weight loss, which can include preventing diabetes and cardiovascular disease, to just the confidence that it gives people, not only personally, but how it impacts their relationships with their loved ones and people that they meet out on the street. It truly is a partnership, and we work together to try and help patients reach their goals. And I feel very fortunate to be a part of that. GLP-1s work primarily in 3 different ways. Number 1, they reduce food chatter. So they actually suppress appetite through a mechanism in the brain. Number 2, they delay gastric emptying. What this means is that it will take you a smaller amount of food to feel full, and you will feel satiated for a longer period of time. And number 3, they cause the pancreas to secrete more insulin, which helps prevent blood sugar spikes throughout the day. Here at Fountain of View MD, we really offer a personalized weight loss program. There are 2 different GLP-1s that we use, one Semaglutide and another called Tirzepatide. Based on what the patient is looking to achieve, we select together the right medication for the patient. Patients can expect to lose anywhere from 2 to 4 pounds a week. For those patients that really want to enhance their weight loss, they can add exercise and intermittent fasting, make some other lifestyle changes to accelerate their weight loss. But it's truly a partnership. We work together to personalize a program for each patient so that we can help them to be successful along their journey. We offer 2 different ways for patients to receive their injections. They can either receive their injections in office or at home. Should they choose to receive their injections in office, they would come by weekly, and one of our MAs or RNs would do the injection for the patient. They can also have the medication delivered directly to their home, and if they're comfortable, they can do their own injections weekly in the comfort of their own home. We have several different resources available on our website that discusses the process of self-injecting. There's a video as well, so we're able to walk you step by step through the injection process, and we are always available to answer any questions you may have. Semaglutide is well known by most as Ozempic. It has another name, Wegovy, depending on which indication the patient is using it for. The generic name is Semaglutide, and it was really the first GLP-1 that was introduced into the weight loss market, the first one in its class. It has multiple clinical trials, lots of data behind it, and continues to be studied for additional indications. Tirzepatide is the next generation GLP-1. They cleaned up the molecule a little bit. It targets an additional receptor. Some of the feedback that we've gotten from our patients, as well as some of the data that's currently available, include more rapid weight loss in a shorter period of time. It tends to also have less side effects. GLP-1s do come with a slew of side effects, like any medication. However, these side effects are very manageable. The number 1 thing is to stay hydrated. Hydrate the day prior to, the day of, and the day after your injection. Common side effects include nausea, reflux, constipation, and occasionally diarrhea, all of which are very manageable. We provide our patients who are nauseous with a medication called Zofran. It simply dissolves on the tongue and helps to curb nausea. Pepcid, Tums, Prilosec are all over-the-counter medications that help to curb the feeling of reflux. And we also encourage our patients to avoid eating right before going to bed. The last thing you want to do is lie down with a full stomach. For constipation, we recommend that our patients take magnesium citrate, either capsules or gummies, 400 milligrams daily. And if that's not doing the trick, they can increase the dose to 800 milligrams daily. Most of the side effects occur right after dosing, so the day of, the day after, and maybe the day following. Very few of our patients come off GLP-1s due to side effects. Some of the common misconception about the GLP-1s is that they're a quick fix for weight loss. This is a marathon, not a sprint. And the patients that do the best tend to incorporate regular exercise as well as intermittent fasting. There is another common misconception that these medications are only used in people who have type 2 diabetes. This is not the case. Trials have shown that patients on the GLP-1s have had extensive weight loss. And so there are multiple indications for these medications. Once you reach your goal weight with your GLP-1, there are a couple of different options. Some people transition off GLP-1s altogether and do fine just by continuing to monitor their diet and exercise regularly. Other patients choose to continue low maintenance dosing. For patients that decide to stay on their GLP-1 for maintenance dosing, it provides the opportunity for patients to be at a lower dose over a longer period of time. Your provider will help you decide which plan will be best for you. So for patients that are beginning to transition off of the GLP-1s, it's really important to maintain good dietary habits as well as regular exercise. Your relationship with food will ultimately change dramatically while on a GLP-1, and you'll be more aware of your relationship with food. But in order to really be successful, it will fall upon some of the food choices you make, the amount of food that you eat, as well as how active you are.